It's absolutely been a crisis for the company. It's a crisis not only in terms of the individual person, right? They have lost a senior executive, so a person that many of them were close to. Also, they have a hole for the company that they need to fill, but also there's this huge groundswell of animosity towards the industry, and they have to grapple with that as well. Honestly, what we have heard from the beginning is that they were shocked when this happened. I don't think this was on anyone's bingo card for 2024, and they just didn't know how to react initially when this happened. The first things that we saw was, increased security at the United Health campuses in Washington and Minneapolis and in New York, and we have seen them taking executives off of their web pages, that type of thing. But in terms of actual communication to the outside world, there's been exceedingly little from United Health, and even internally, some of the reports that we have seen have essentially downplayed the situation and told employees to not really pay attention to social media, to not take this outpouring to heart. They do have an awful lot of work that's going to have to come. They have not yet done it, and it's going to be interesting to see how it plays out. There's really not an awful lot that they can do at this point, given how much antagonism, animosity, and straight up hatred towards the company from people who have suffered in terms of not being able to get the kind of health care and coverage that they've needed. I think that it's been really shocking for many people.
Which is so surprising, because you would have thought when you have a tragic event like this, it would be the opposite, that you'd see an outpouring of support, right? And that's just not been the case. How has it reflected in United Health, but also just in other companies as well? Like there was a debacle with Anthem last week and paying anesthesiologists.
Right, absolutely. This is not something that's specific to United Healthcare at all. It is something that comes from the health insurance industry. Obviously, the way these companies operate, they do, when you talk to them about it, what they're doing is they're trying to make healthcare more efficient, more affordable, making it possible for people to get access to the care that they need. But in fact, the way that a lot of them make money is by reducing the expenditures for healthcare insurance. And that, again, not specific to United Healthcare. We've seen other companies dial back their in-person appearances. They've had executives pull back events that were going to be public, that were closed, moved online. Everyone is reevaluating their security at this point, and the way that they move forward at this point is just uncertain. How you can actually rectify something that is systemic to the industry. This is how it operates. So they're going to need to rethink, and how they go forward, I don't think that they know yet. They're still trying to figure that out.